infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. Now, in a recent op-ed, Pacific Research Institute President Sally Pipes asked, will COVID-19 launch an epidemic of cancer, as the pandemic stay-at-home orders have caused patients to put off routine cancer screenings? She writes that mammogram and colonoscopy rates fell between 86% and 94% in March. One study estimates that during the past 3 months, more than 80,000 cancer cases have gone undiagnosed. Now, the nonprofit Prevent Cancer Foundation recently announced the Back on the Books initiative to get Americans back to scheduling medical appointments like physicals and routine cancer screenings. So joining me today to talk about this is Lisa Berry Edwards. Lisa is the Managing Director for External Affairs at the Prevent Cancer Foundation. Hi, Lisa, and welcome to the show.
Hi, thank you so much for having me.
You bet. Well, fears and concerns of COVID-19 exposure are keeping Americans away from doctors, increasing the risk of preventable cancer deaths. Now, the Prevent Cancer Foundation released a survey recently concerning people missing appointments and screenings. Lisa, can you talk about some of these troubling numbers in this survey?
Absolutely, yeah. Our survey, the Prevent Cancer Foundation survey, was done at the end of May, and we saw that 43% of American adults had missed a routine medical appointment because of COVID-19. 35% of American adults had a cancer screening scheduled during the pandemic and missed it. And there's been other data coming through that you mentioned in your intro that are showing even higher numbers. But what I think is really telling is that 22% of people who had routine medical appointments or screenings scheduled for June through August were planning to postpone or cancel. So that's telling us that this inclination to postpone or cancel these appointments is not going away right now, even as the doctor's offices are starting to open back up.
Right. And with this fear of getting exposed to the virus, as you said, people are missing appointments, but this actually puts you at a higher risk for other very serious health issues. Can you elaborate on that?
Yeah. So I want to start with the caveat that nothing is one size fits all. So if you're someone who's at higher risk, if you're a cancer patient or a survivor, for instance, then the risk calculation of your potential exposure to the coronavirus is different. So everyone should be talking to their doctor about that. But what it really is boiling down to is that we know screening prevents cancer in the case of colonoscopies and pap tests, or it can detect it early. And the earlier you detect cancer, the more likely it is that treatment will be effective. So if people are missing their routine screening appointments, we're going to see a lot more missed or late stage cancer diagnoses that could be prevented, and screening saves lives. So that's the main point. In particular, in the Northeast, where coronavirus rates have stabilized or decreased, we want to let people know how critical it is that you take care of your health and you get those appointments back on the books. I do know that in other areas of the country, and I think maybe you're in Florida, the calculations might also be different there.
Sure. So, Lisa, how do you convince people that they can go safely to the doctors? Because they're watching 24/7 these horror stories on cable news, for example.
Yeah, it's tough, and that came through loud and clear on our survey as well. That was really the main reason that people are canceling their appointments, because they're nervous about exposure to the coronavirus. But I do want people to know that your doctors have been carefully studying how to keep patients safe and implementing a ton of new precautions. So some providers are having people check in from their cars so that they're not overcrowding waiting areas. They're doing temperature checks and COVID-19 questionnaires. They're requiring masks and making hand sanitizer available. So if you're feeling nervous about rescheduling your appointment, you should call your healthcare provider and ask them what they're doing. It's definitely okay to ask, and your doctor wants you to feel comfortable during your visit. And I can say, I mean, just to be really candid, I just had a colonoscopy myself, and I was very nervous about going in, I have to say. But once I got there, I felt very safe because I could see all of the precautions that the provider was taking. So call your doctor, have the conversation, and see what they're putting in place, and it might make you feel a lot better.
Yeah, and to piggyback on that, can you talk a little bit about the focus of the Back on the Books campaign?
We want people to take charge of their health. So, we recognize with this campaign that it's different everywhere. In Florida, that area is dealing with a huge surge of the coronavirus right now. In some areas of the Northeast, it's a little more stable or even decreasing. So we want you to talk to your healthcare providers, and even if they recommend waiting because of where you're based right now, the time will come when it's safe to go in, and at that point, you're going to need to reschedule, and don't wait for your doctor to call you. It's up to you to take charge of your health and to call in and get those appointments back on the books.
And of course, your focus and the focus of your organization is on preventing cancer. Can you give the audience a rundown on the numerous ways to reduce cancer risk?
Thank you for asking about that, because I think there are so many things we can do in our everyday lives to reduce our cancer risk, even when we're stuck at home and in quarantine. So I'll kind of run through the top line here, but it's important to protect your skin from the sun, especially as people are spending more time outdoors right now. And we know that skin cancer is the most commonly diagnosed cancer in the U.S. and also the most preventable. Don't use tobacco, don't vape, and if you're currently a tobacco user, you can seek help to quit. It's important to eat a healthy diet, maintain a healthy weight, and be physically active. You can get immunized, so there are vaccines available for HPV, which can cause at least 6 types of cancer, and also hepatitis B, which is a leading cause of liver cancer. And it's important to know your family health history so that you can talk to your doctor and figure out your personal risk, and get those routine cancer screenings that we've been talking about.
Okay. And lastly, I want to go ahead and give you a chance to talk about the work of Prevent Cancer Foundation.
Yeah, so our focus is saving lives across all populations through cancer prevention and early detection. And we were the first nonprofit organization in the U.S. to have this as our sole focus, and we remain the only nonprofit with this as our sole focus today. So we have a ton of information on our website. It's preventcancer.org. If you're interested in particular about the Back on the Books message, it's /Back on the Books. And we're on all social media, so you can find us on Facebook, Twitter, Instagram, LinkedIn, at Prevent Cancer. But we want to let people know what they can do to be reducing their cancer risk, because it's actually about 50% of cancer cases and 50% of cancer deaths that could be prevented with the knowledge that we have right now.
Excellent. And I'll go ahead and link to the website and some of the social media in the show notes when I publish the podcast. And I want to thank you, Lisa Berry Edwards, for your time and your expertise, ma'am.
Thank you so much.